Hi everyone, welcome to the webinar today. We'll just give it a few more moments just to see if any latecomers want to join before we get started. Still plenty of people flooding in, so that's very good. All right, well, we might kick off. So good afternoon, everyone. Welcome to today's webinar, Diagnosing and Dealing with Continence and Aged Care. My name is Ryan. I'm the Marketing Manager for SSS Australia. Just wanted to go through a few housekeeping matters before we kick off today's presentation. This webinar is being recorded and we'll be able to share the recording with everybody in attendance and everyone else who registered after the webinar today. So keep an eye out in your inboxes over the next couple of days when we send out all the resources from the webinar as well as the recording. We should hopefully have some time at the end of the webinar today for a Q&A session. So if you have any questions, if you think of any during the presentation, please pop them into the chat box and we'll get to those at the end of the presentation. And do keep an eye on the chat as well, as we'll post a link in there towards the end of the presentation to go to our feedback survey. This is how you can request your certificate for your CPD. So make sure to do that. So I'd like to thank our speaker for today, Karen Newby. Karen is a registered nurse and clinical development manager for Tanner with close to 40 years of experience in healthcare. She is a certified continence nurse advisor and leads national clinical and education initiatives, including the popular Tanner Tuesdays webinar series. Alongside her clinical work, Karen is a qualified integrative health practitioner and personal trainer, currently studying nutrition. She brings a holistic lens to continence care and is passionate about supporting people to live with strength, dignity, and vitality at every stage of life. So without further ado, I'd like to pass it over to Karen to get started. Thanks, Karen.
All right, thank you, Ryan, for that lovely introduction. And for everyone on the call, thanks for having me today as we explore continence management and everything that kind of goes into that. So, well, it's not everything. It is as much as we can fit in the webinar. So let's give you some pictures to look at. And I'm going to share my screen. Okay. I'm just going to pop this down a little bit in case there's some chat. Okay, so let's have a look at what we're going to explore today. So what I thought would be really good for this webinar and the people on the call is firstly know about the different types and causes and the prevalence of incontinence. And then look at the risks and of poor management, of poor continence management. And then we're going to apply some knowledge that you've learned to write some really good continence care plans, some very holistic care plans, so you get good outcomes for your clients and your residents. And then feel really confident in choosing the right continence products, and then we'll have some questions at the end. So interactive, informative, so let's get going, and thanks for everyone for joining. So let's hit it. So we have to start at the beginning. So we have to really know what incontinence is first before we can care for someone and put a plan in place. And if we look at what the International Continence Society definition of incontinence is, it's a term that describes any accidental or involuntary loss of urine or bowel motion, feces, or wind from the bowel, in fact. And the reason I put this on is because if you're assessing a person with incontinence and they may say, look, I'm not incontinent, but I do drip a little bit, then we go back to the definition of incontinence, and then you can gather that, you know what, they are incontinent, and there may be something that you can do to actually help them and manage their incontinence. So very important thing firstly to do. And when we have a look at the prevalence in Australia, and these figures are coming from the Continence Health Australia, so formerly known as the Continence Foundation of Australia, they've had a name change. So interestingly, we start on the right there, 1 in 4 Australians are incontinent, which may surprise you. You can type things into the chat if you like, if you think, oh, geez, I didn't realise there were so many. 1 in 3 women experience urinary incontinence sometime in their life. 1 in 10 men are incontinent in Australia, and 1 in 20 Australians experience fecal incontinence. And the reason I put stats on is because if you're speaking with someone, a client or resident that has incontinence and they may feel alone, then these kind of figures can help them understand that, that they're not alone, and it is treatable and managed, can be managed. We'd better look at the urinary system. So dust off your cobwebs with the urinary system, because it does make a really difference if you understand how the urinary system works in order to prescribe the care that someone needs. And I'm not going into too much depth, so don't worry too much. But when we look at the urinary system, we have 2 kidneys. They're making the urine, and they're filtering the blood and keeping all the good things in the body, and then releasing all the waste products through the urine, also balancing out the fluid in our body too. And then that urine travels down the ureters there into the bladder. And does anyone know how much the bladder holds? There it is there. It's a muscular organ called the detrusor muscle. You can type in the chat how much you think, how much the bladder actually holds. If anyone wants to do that, they can do that. Let us know, Ryan, if anyone's putting in some answers there. And then I'll come back to that. Once the urine's in the bladder, it then travels down through the urethra there and out to the outside world into the toilet, which is where it's meant to go. But some people, that's not a thing. So the bladder, if you don't know, it holds about 400 to 600 mils in a healthy normal bladder. We urinate about 4 to 7 times a day. So maybe you can do your own little data collection and start looking at how often you go to the toilet, depending on obviously how much you drink too. And the other thing to mention also is underneath the urethra there, or around the urethra, are the pelvic floor muscles, and they support all the organs, and they assist with maintaining continence as well. Something not to forget. There's a very complex nervous system. I don't have time to tell you all about it, but I think just to know that, that maintaining continence does take, a lot of synchronization between 2 parts of the nervous system, the relaxing nervous system, which is parasympathetic, and the sympathetic nervous system. So just something to be aware of there. And then for normal bladder function, so what does that even look like? So in order for the bladder to have normal function, it has to be able to fill up. And if you think about someone who does have incontinence, and you'll be able to then track where the incontinence may be stemming from a bladder function perspective. So firstly, it has to be able to fill up, and then there needs to be an awareness to actually go to the toilet or initiate micturition. So we have to be able to find an appropriate place and time. So that could be an issue for someone who has dementia or is living with dementia. And then they have to be able to hold on until they actually get to the toilet or find somewhere to put the urine into, a receptacle of some sort. They have to be able to be mobile to actually get to the toilet. Then the bladder has to do some amazing things. The bladder has to be able to contract, and that little urethra, which has a muscle around it, has to be able to relax to let the urine out. And then when you're sitting on the toilet, you have to actually be able to maintain the flow until the bladder is fully empty. So it's amazing that, we are, for those of us who are continent, that we are, because it's such a complex function of the body. There's different types of incontinence, and these are really good to know, because if you can identify which type of incontinence someone has, then your care can be personalised around that type of incontinence because of the symptoms that those types of incontinence have. So if we look at the diagram on the left, the first most common type is stress incontinence. And where my little mouse, you can see at the bottom here, so we have some weakness in that pelvic floor. And because of that, when there's extra pressure above the bladder pushing down, it can then obviously cause some leakage there. So things like coughing, sneezing, laughing. Some of your clients might be continent sitting down, but when they stand up, that extra pressure can actually cause that leakage. And so, when we're managing stress incontinence, it really is about obviously trying to improve the tone of the pelvic floor, as well as some good toileting schedules in place, just so that the bladder doesn't overfill so much that that extra pressure is pushing down and adding to the leakage. So the second type, number 2, there is urgency. So that's any reason why someone has some urgent need to go to the toilet. The bladder starts contracting. The bladder is super sensitive, and people can experience lots of frequent visits to the toilet, but also that very sudden urge to go. So things like urinary tract infections, anything in the bladder, in the bladder that causes that bladder to contract a lot. So yeah, little bugs that find their way in there, bladder stones, bladder cancer, sometimes tea and coffee, caffeine can actually cause some bladder sensitivity. So it's, from a planning perspective, then once you understand what is causing that, it might mean, hey, we might cut back on a little bit of caffeine because you have 8 cups of coffee during the day. That could make a huge difference, to someone's life. You can also get, number 3, there is a mixed, so you can get mixed incontinence, so a bit of both, and then overflow. And what we can see there is the prostate gland. This is a male bladder, and we can see the prostate gland around the urethra. And as that grows, so in men, that prostate gland grows over time and can actually block the flow of the urine outside the bladder, and it builds up into the bladder. And then they just get this kind of constant drip. They never feel like they're emptying. And so it's really good from a, if you ever see that, or if a male complains about some hesitancy, never feels like they can empty, really important that from a multidisciplinary approach that you refer out and they get the help that they need. Now, I've got another couple of slides showing the functional incontinence. So let's just go back here. Oops, there we go. So functional incontinence from an aged care perspective, and any perspective really, is why someone can't get to the toilet. And it can be multiple reasons, such as environmental, physical, intellectual. And there's a lady here with a cup of tea just reminding me that even arthritis can be put in this type of incontinence. So, someone might be going to the toilet, but they can't actually manage, the belts and buckles and zips and stockings and things like that because of some low function in those upper limbs in the hands to remove clothing or even to manage their hygiene. So something to think about there. Got people who find getting to the toilet more challenging, and even the position of the toilet could be in the backyard, and so a longer distance to walk to the toilet. And then, yes, people with who are living with dementia, and so maybe they can't remember where the toilet is, or they can they can look at, for example, a rubbish bin, and they might actually think it's a toilet, and so then not being able to then to pass urine in the right place. And we can't forget about fecal incontinence. If you remember those stats, 1 in 20 Australians are experiencing fecal incontinence. And, there's lots of different reasons for that. And we're actually seeing higher numbers in this decade, in the last couple of decades, in fecal incontinence, possibly, to do with diet and multiple of other reasons. So what triggers incontinence? It's always good to kind of know which types of medical issues can trigger incontinence. We call them at Tanner cause states, so what's causing the incontinence. And you might, notice some of those medical issues there, or even, natural things like childbirth and menopause that can actually put people at risk of developing incontinence. And of course, the elderly and the frail. And I think it's always important to remember to consider the frailty of a person when we are managing their continence, and also in the assessment process, because this allows for us to alerts us for any extra risk factors. And you can see there, the complexity of aged care. And, even though incontinence isn't a natural part of aging, there's a lot of factors in there that kind of go against us as we get older. One of those, is nocturia, and it's a hormone thing. When we get older, a little hormone that at nighttime called antidiuretic hormone is decreased overnight. That's the hormone that concentrates our urine. And so during the night, elderly people can produce the same amount of urine as they do during the day. And so quite often they do have more incontinence at night, and often they are quite thirsty in the morning when they wake up, because they're making the same amount of urine at night as they do during the day. So lots of things to consider with the elderly. But regardless of whether you work in any of these different healthcare settings, we need to manage the risks and then optimise outcomes. And it's our responsibility as healthcare professionals and carers to do that the best way that we can. So let's have a look at the risks. So we'll delve into a few of these risks just to kind of remind you of, the people that are in your care. So if someone has constipation, it poses quite a significant risk, as it can exacerbate incontinence issues and lead to discomfort and complications. And the reason for that is we always think of the body and its systems as separate. But if you really think about the position of the bowel and the bladder, and when we talk about urine incontinence in this case, if you've got a constipated bowel and it's pushing on the bladder, so the bladder doesn't have as much room because it's there's limited space because you've got the bowel pushing behind, you can actually get more urine incontinence as well. And if you're constipated, you can get some incontinence with that fecal incontinence. The other one really important is dehydration. So particularly in older adults, as it can worsen the symptoms and lead to things like urinary tract infections as well. And maintaining proper hydration levels is really important for overall health and urinary function. Delirium, quite overlooked as a risk of incontinence, and it can occur for various factors, including medication side effects or obviously underlying health conditions, but it can exacerbate incontinence and pose challenges to management, continence management there. Depression is a common but often underestimated risk factor for incontinence, because loss of control and dignity can significantly impact mental health, highlighting the importance of addressing psychological as well as physical symptoms of incontinence. And let's not forget falls. So falls are a major concern, especially for people with mobility issues resulting from incontinence. And there's been lots of studies on this where, getting to the toilet, so maybe they're in a bit of a rush to get to the toilet so that they don't have any leakage. But also, if you have someone who's using equipment to get to the toilet, they really have to think about then not only holding on until they get to the toilet, but also using that equipment right as well. And that can take some time, especially for the elderly, to have something else to think about besides taking one step at a time. They've got to move the frame, etc., or the stick. So falls can be a higher risk as well. And then we have some skin conditions, and I'm going to talk about this a little bit later. So incontinence-associated dermatitis and pressure injuries. So these are risk factors from incontinence directly, the incontinence-associated dermatitis, and you actually have a higher risk of pressure injuries if you have IAD too. And then also risk with incontinence is skin tears, another possible kind of complication, particularly in fragile skin, especially if the skin is compromised there through IAD. And also some risk associated with incontinence is sleep disruptions, and we all like to get enough sleep, and that can occur due to nocturia or waking up at night and needing to visit the bathroom frequently. And if that's a risk or there are symptoms that someone does have sleep disruptions, they are actually then at risk of falls as well. So it has kind of a snowball effect. So by identifying those risks can actually help you then to the next stage where we're looking at continence management. So I just wanted to put this into, because I know a lot of you are working with the aged care sector, and we know the new strengthened standards are coming in. Well, they should have come in yesterday, but the new date is the 1st of November. So lots of people are doing a happy dance, giving us more time to put some really good things in place to actually manage, monitor and risks of incontinence and all the other things as well. But when we look at the outcome of 5.5, so the standard is 5, which is clinical care. And then I've built this out on the screen there, so you can see down the bottom there. So there's 7 standards, obviously the person in the middle, but continence is sitting in clinical care, and then it's under clinical safety outcome. And what they, the Commission would like is high quality, safe, person-centred and evidence-based and coordinated care, and that includes continence care. And continence has its own outcome first time, and that is, and there's 4 action items, and these are really, really key to understand, because it then helps you with the care. So optimising the older person's dignity, comfort, function and mobility. We spoke a little bit about the functional incontinence there. Ensuring safe and responsive assistance to toileting. So really important to also look at that in your care planning. And managing incontinence, and that's very broad, but it does include, managing your stock levels as well, making sure that you've got the resources and systems and processes in place to manage continence. And then the last one is managing the older person's skin integrity and minimising, it actually says there, incontinence-associated dermatitis. So I just briefly wanted to show you this. I have lots of resources if you want some more information on IAD. And when we look at preventing IAD, it's actually quite a simple methodology. It's evidence-based. There's tons of papers to support this. So the first thing we need to do is manage the incontinence. So we need to reduce or ideally eliminate skin contact with urine and faeces, and then identify and treat reversible causes. And the second step then is to implement a structured skincare regime. So when we're looking at care planning, these are the two things that are really important when you're actually writing the care plan. So you manage the incontinence and implement a structured skincare regime. And we've tried to make it at Tenor really simple, like a really simple methodology to kind of help you with that. And we've got our little model there. So we use the Keep It Dry, which comes under managing continence. So we want to keep that skin dry. And then we look at the skin as in keeping the skin clean and protected, and that's through your structured skincare regime. So continence management, as just a bit of a recap. So what have we learnt so far? We know the different types, the causes and the prevalence of incontinence. We understand the risks of poor continence management. So now we're going to apply some knowledge to write some good continence care plans and feel really confident in the products that we're going to prescribe. And I can see I think we're going good on time. Ryan, are there any questions in the chat that do you think that might need immediate answering?
Not at the moment, but if anybody has any questions, feel free to put them in the chat now. We can start addressing those.
Yep. I can see now. Kim, you were almost on the money there with the bladder.
Almost dead on.
350 to 500. What a legend. Hey, when you get older, your bladder capacity actually reduces too. It's not so stretchy. So you might find as you get older, and your clients as well, that their bladder doesn't hold that much. Sometimes only 100, maybe 200 mils. So they might want to get up and go to the toilet more often. Okie dokie, let's keep going. So I think this is really important, and it's something that I've been, really focusing on when talking about continence assessments, which is where we're heading now. Before you even start a continence assessment, it's really important that we, look at the person as a whole and ask the person that's experiencing incontinence, what is important to you? And it's important to frame that conversation with sensitivity and dignity and person-centered intent. Not everyone wants to talk about it in front of all their family. Some people need their family. Some people, don't want to have their family there, and so it's important, that you kind of establish that, because it's still quite a taboo subject. And when we look at some best practice models in continence care, there's one of them, which is the best practice model of continence care in residential aged care, that was released by NARI. Goals should be explored using supported shared decision-making priorities. And those are the individual values, preferences of the person. And, you know, opening up that conversation can be hard. And there's a couple of questions there that, you know, I've used to kind of get the conversation going around goal setting, so that whatever you create in the care plan, then it really is centered around their goals. For example, what does being independent with your toileting mean to you? You know, what does that look like? How are we going to get you there? And sometimes, you know, it's not a fast outcome, a good outcome like that. It could, you know, take some time, a multidisciplinary approach. You know, you might obviously need nurses, maybe GPs, physios, OTs, that whole band of health professionals to encourage someone to hit that goal. So there's a couple of questions there you can use. But when we look at a continence assessment, and before we can even, you know, write a great plan, we've really got to look at an assessment to determine the needs, understand their goals and what's important to them from a preference perspective as well. And I find a lot of people, when I ask and advise with some continence management, they say, hey, Karen, I've done the bladder assessment, or I've done the bowel assessment, and, you know, and that's what they think is a continence assessment. But it's so much more than that. And so I'll take you through what a continence assessment really looks like. And it's something to kind of consider when you're looking at your own internal continence assessments in the places that you work. So taking a really good history is important, medically, surgical, as I've written there, you know, and what's actually working for them from a historical perspective, and what have they tried and actually didn't fulfill their needs and goals. That's really important too. Their obstetric, you know, how many babies they've had, what kind of deliveries, and from a urological perspective, you know, if they had any surgery or how's the prostate, that kind of thing. So once we've got the history, so we start collecting that kind of data, historical data, then we need to do clinical and functional assessments. So you might, that's where, you know, your physio, your OT may come in into play, as well as the nurses looking at the skin health. It's really important to have a look at the skin health because of the high risk of skin issues from incontinence if not managed right. Also cognition, that's really important too, because that will help them design the plan around the needs of their cognitive status. Also need a waistband measurement if you're going to use continence aids. You know, if you're more clinical, you may need bladder scan. If someone is fecally incontinent or have a sensitive bladder, maybe you need a dietitian to kind of assess the person. You know, there could be certain foods that are upsetting the urinary or the bowel. And also, you know, quality of life assessment as well. You know, how is this, you know, incontinence affecting their life? So once we've got all of that information, as I said before, the skin assessment, if you're in aged care, you'll get out your little Ghent IAD categorisation tool, because we want to be measuring. We want to know if they have IAD, what category they're in, and then obviously take measures to improve that and treat it. Then we get the bladder diary going. So we start looking at times of void, the pad condition when we're checking it, when the pad changes are happening. Now, how many pad changes, you know, are happening during the day, any leakages, and obviously the toileting times. Same for the bowel. So the bladder is over 3 days, 72 hours. The bowel is over 7 days. And then we look at the findings. So we're looking at what type of incontinence do they have. And then we look then at the care plan and all of the multitude of different aspects of the management plan. And then where it's got evaluation, we have to actually be evaluating the care plans regularly. We need to be looking at the skin regularly as well and reporting those IADs in the quality indicator reports if you're in the aged care sector. And then we go round and round again. So I hope that helps. I hope you've been thinking about your continence assessment that you are using and the data that you can get from that to make really good decisions and present different remedies for the person to get their outcomes. So I think, there's a lot of things. So not only when we're looking at care planning, so you've got all your data. Now we're looking at the standards and all of the action items that are coming from the standards to consider. And we're also looking, at the risks as well. And so, and that one too. So looking at that's why I did that extra slide, because now we're going to really look at the continence management plan. So now we're going to zoom in into intervention strategies that you can use. It's not everything, but I've made a pretty good list of some ideas that can be used for managing incontinence. So from a behaviour and lifestyle intervention, so these are really first level strategies, and they're things that you can see there's no continence aids or anything as yet. Really, it's looking at what can we do before we even look at continence aids and things like that. What other things could we be doing to actually help this person manage their incontinence? And they're things that could be, like bladder training, prompt avoiding. If someone has stress incontinence and they're overweight, putting that extra pressure on the bladder, maybe some pelvic floor exercises and some weight loss to, help with that if that's a goal for the person. If they have a cough, so if they have stress incontinence caused by a really bad cough, how do we then work with the GP and anyone else that we need to reduce that cough? If they're a smoker, can we reduce the number of cigarettes or even quit smoking, that kind of thing? Medications, working with the GP. Some medications such as diuretics are causing the incontinence, that massive volume of urine that's leaking from the that's being produced, getting to the toilet on time. So maybe there's some work around those medication times so that they can improve their quality of life. If they're diabetic, maybe helping and with that and getting the treatment that they need to manage their diabetes, because quite often if their diabetes isn't managed, they're producing a lot more urine and a lot more incontinence because of that. And then, as I said before, the limiting the caffeine, the alcohol and spicy foods can do all sorts of things too to the bladder and the bowel. So even before we even look at, okay, we're just going to put a pad on someone, there's a lot of things that you can do beforehand. So when we're looking at the environment, heaps of things that you can do from an environmental perspective. Engaging the OT, definitely, they are all over this. They have such an amazing knowledge and experience in this area. But, adjusting the environment You know, do they want the light on in the bathroom so they can see during the night? Making sure that the area is, there's no clutter around. Toilet signs, pictures of the toilet on the door, especially for those with dementia. They can't quite decode the word toilet, or all the doors kind of look the same. Just putting a picture on the door can make a difference. And obviously the height of the toilet for getting on and off the toilet. So just a couple of ideas there and examples of environment. And then the pelvic floor exercises as well, strengthening those pelvic floor muscles. And just because someone's old doesn't mean that, as I said before, it's not a natural part of aging. But if that pelvic floor is weakened, I've had elderly people who've actually improved their pelvic floor and reduced their incontinence, and sometimes even eliminated their incontinence too. So, you know, it's really important that you do cover that as well. And for fecal incontinence, you know, lots of things we can look at from a fibre intake. You know, are they getting the recommended amount? Are they eating too much fibre, which I've seen as well, having all those high fibre drinks and diets, and, you know, they wonder why they're on the toilet all the time. They actually had too much fibre. Making sure they're having enough fluid and exercise is important, and sitting on the toilet correctly. And on the left-hand side of the page, there we can see someone sitting on the toilet with you see their knees are higher than their hips, and that is so that is actually easier to pass stool, the feces into the toilet. Yeah, so this person's got a little stool underneath to actually get that good position. And I challenge you to actually try it at home, and you'll be amazed at how much better you can empty the rectum. And now we get on to the continence and skincare products. So as you can see, it's kind of the last thing. So what I can't get down the toilet, what I haven't, when you're writing a care plan, you've looked at the environment, you've got pelvic floor exercises if someone's willing and able to do them. Looked at the fecal incontinence, you've got the behaviour and lifestyle. Now, what we can't, if we still have leakage, now we need to absorb that into something for the social incontinence. So when we're looking at continence aid choice considerations, there's a few things. So there's a bit of a knack to it to actually get the right product. And the first thing is that I look at and we teach is mobility, because when we're looking at the style of the product and somebody's mobility is they're up and active, we need to choose a product that allows them to maintain their independence and control. And so, you know, choosing a product, you know, such as pull-up pants would actually help with that. As an example. We also look at cognition, because, you know, if someone has quite advanced dementia, then, you know, if you give them a pad inside their pants, they might actually, you know, not kind of register that. They take it out, they flush it down the toilet, rather than, let's say, pull-up pants again, that, you know, you can pull up easily up and down, and they're like normal underwear, and the person can associate that product as normal underwear. I always, when I'm going through choosing continence aids with people, is always halfway, just check in. You know, if you're thinking about a certain product, you've looked at their mobility, look at their cognition, it's always a good time to kind of check in. You know, I'm thinking this, we've got a little bit further to go, but, you know, how's this looking at the moment? And that way you're engaging the person in that assessment and choice process. What's really important is, for some people, is to maintain their masculinity and femininity. And there are products on the market that certainly tick that box. Some beautiful feminine type products. I've got a picture of a few, and male as well. And it also suits the anatomy, because men pee more at the front, and women, we pee in the middle, and kind of everything dribbles to the back. So something to consider there as well. Now you can look at the volume, how much urine that you actually need to absorb from a leakage perspective over a certain period of time, and then also the waistband measurement as well. So like when you're getting your clothing right and you want to make sure that your actual clothes fit, it's the same with continence products as well. We want to make sure it's comfortable around the waist, not too tight, but quite a firm fit, so it's firm up against the body. So yes, the style does matter. And I'm just checking, no more questions there. They're very quiet there, Ryan. Hopefully we've still got them all. So lots of different styles. And so I've got some pictures here, and I've got our little consideration, choice consideration little picture there on the side. So from a pad point of view, this is a female pad. Generally, males wear them too. But when we're looking at styles, pads are really great for people that are active. So from a mobility perspective, as I said before, with cognition, they have just a bit of mild dementia, that might be okay. But as if the dementia advances, that's sitting in the underwear. Some ladies, say to me, oh, I don't know why they keep giving me this pad, Karen. It's I haven't had my period for 50 years, and so I don't know why they keep giving it. So it can cause some confusion. So from a gender perspective, we have male and female pads that actually go inside the underwear. Also, they have to have the dexterity. So just going back to probably mobility, is they have to have the dexterity to peel the sticky off the back, the sticky paper or release paper off the back. So just be aware of that too. And from a absorbency, or how much urine, it starts from, we have some liners that have an absorbency of 50 mils or 25 mils right up to almost a litre. So there is a wide range of absorbencies there. And obviously we don't need a waistband measurement because they're worn in their own underwear. And with underwear, just make sure it's firm fitting too. Any kind of gaps in underwear, or if it's too loose, the pad will leak. So just be aware of that too. There's the pants, which I've spoken a lot about. People love pants. It's like normal underwear. As I said, continence isn't a normal part of aging, but, it's certainly, how can we make it? How can we normalise the products that they're wearing? So I've got a few hot little pants to show you in a minute. So some hot topic pants at the moment, and there's some changes in those pants. So hold on for that. But it's the same from a mobility perspective. Definitely, up and about, activity wise, they come in lots of different absorbencies. Great for people experiencing dementia, and making sure you get a good waistband measurement on that too. Then you have the all-in-one products, and there's kind of two different styles. There's the one, this one's called a flex. It goes around the waist, and it just makes putting on the product a lot easier, and the absorbency actually goes up much higher, sometimes up to 3 litres in these all-in-one products, in the flex definitely. So when we're looking at people who are non-weight bearing, needing a lot more care, who's actually putting the product on. So from a mobility perspective, they might be non-weight bearing, not really moving around much on their own. And so the product then really is about getting looking at the carer and making it easy for them to put it on. And then there's the old-fashioned, this is, we call it a comfort, but it's the pad that goes in the neck pants. Still a great product. It's kind of going out of vogue now because the pants, everyone just really loves wearing the pants. They're a lot easier. And this product actually goes inside the net pants. And then there's some other products too. So it's fecal liners and disposable bed pads as well, if you need them. So lots of different styles. And if we apply this now and we look at a little case study here of Maria. So she's 84 years old. And she has some osteoarthritis. So, automatically we're thinking about, what's going to be easy for her from a product perspective. She's got good long-term memory. She's got good communication. So it's going to be able to tell us what she needs. How she walks is with her little four-wheel walker, slowly but surely, independently. And her leakage over the day is about 500 mils over the 8 hours. And at night time, she's doing something called double padding. So she's putting another pad inside her base pad. And that's not a good thing because you've got extra pressure and it causes a lot more friction and more susceptible to pressure injury from friction and shear. So her goals are to sleep through the night and improve her skin, maintain independence, and avoid bulky and visible products. So, there's lots of things that, we can do for that, for Maria. And when we're looking at dignity, it's clear there that, she's looking for products for self-management. She wants to maintain her independence and, looking at, empowering her from her input of comfort and colour and style. So we need to consider that. And then some tailored solutions there from her mobility, volume and her preferences. So what I wanted to show you quickly was this. I know we're kind of getting to the end because we're kind of in question time, so I'm going to go really fast now. But in a range guide, it can be quite complex, and this is just one part of our range guide. And so when you look at this, it can look quite complex when you go, oh, where do I even start? But the really good thing is in the tenor range guide, there's this part over here, this side, and it actually takes you through those steps. So we've condensed it down to 3 little steps. So from activity, and then we can look at leakage and then look at the waistband size. So for Maria, she is up and about, she's walking around. And so it's hard to see probably on here, but we can see she's mobile and active. And then we are looking at the volume. So we need to cover about 500 mils. So when you go down the page on the left-hand side, it's about volume. So we've already kind of decided it's either going to be pads or pants. And then we've got the volume on the left, and then kind of looking at these products then, there they are. And then on the range guide, we then go to the style. Then we find the product here that would suit her from a volume perspective on the working capacity volume here. And then we'll go ahead and find the right size and maybe the colour that she wants. So just as an example, that's how you apply those principles when we were looking at the considerations when choosing a product. So I know that was fast, but we are here to support you. Today's just the first of maybe your experience with this, but we can certainly go deeper if you reach out to us. But just to kind of end off, I wanted to show you, a few of the products you might already be using. So the tenor pants are having a makeover. They're actually changing from an absorbency, and there's a lot more features on them now. There's higher absorbency, so they absorb as in twice as fast. And we compared our product or our own product. We race against ourselves. So we're getting a lot more security. People are feeling way more drier, 30% drier. And obviously the skin is staying better protected as well. So you'll see these changes come through. They're called Pro Skin 2. And that's going to happen on all of the absorbencies and all of the sizes. So keep an eye out for that. Love to hear some feedback. Already getting some amazing feedback on the new and improved tenor pants. And you may not know this one either, there is a night pant as well. So these are designed obviously for better sleep. And the way that they've done that is they have a lie down protection. So there's a lot more of the super absorbent polymers in the back of the product, because a lot of people sleep on their side or their back, and quite often their urine can kind of run out the side. So the lovely team at Tenor in research and development developed this product. So think about that for your nighttime clients as well. When we're looking at gender specific, lots of different colours there. Even for the men, there's the navy and then there's some white stripes. So just something to think about there. And then we're looking at skincare, just to kind of finish now, implementing a structured skincare program. So we have lots of different products. So the Tenor shampoo shower is worn in the shower and you rinse that off. All the other ones you can see on the screen, the wash cream and the mousse, you just apply it on the skin, onto the dry skin, and then you wipe it off with a soft cloth. And that's actually a rinse-free type of product. Same with the wet wipes as well. So you don't need to rinse the product off, because all the good stuff, the cleansers and the protectors, are actually in there. And just to note that our skincare is endorsed by the Skin Health Alliance group, who are a leading group of dermatologists over there in London, and they put products through the ringer. And so lots of different hurdles to jump over to actually get this endorsement. So have a look for that logo on your products. It's really important. And then to protect the skin, so beautiful body lotion. So applying that twice a day to the limbs, actually also as a little side note, can reduce skin tears by up to 50%, as per the literature. So make sure you're applying that to the elderly people twice a day. And for those that just need a bit more protection, the barrier cream, which is a really simple formulation to protect that skin, especially for those who've got fecal incontinence and they just need that extra kind of protection. So as a recap, these are all the things that we learnt today. And I hope it's kind of made a little bit of a difference to the way that you're thinking about continence management, giving you a few ideas to kind of think outside pads, look at a person as a whole, and then also, how can we assist you more? So one of the wonderful offers that we have is a membership. It's all free for you to be part of our Tenor Assist members, where you can get all the resources that you need to actually, including that little product select kit there, to actually ensure that you're having these conversations, but you've also got the resources that you need, such as, the product selector kit's got all those examples of the products for you, so that your clients can touch and feel all the different types of products, the different styles, access to sampling. So those are free samples, because you want to get the product right before you actually purchase products. And also in the membership, signing up to Tenor Tuesday, we have a monthly webinar. If you love this and you want more, we do a monthly webinar for half an hour, which you're all welcome to. Lots of things to explore there with Tenor Assist. A little QR code is there for you, or you can go to tenorassist.com. Regional manager for Queensland for Tenor is Felicity Hill. Her email is there, so you can contact her. And also, you've got your wonderful customer service team there at SSS Australia, who can take your call as well and talk about all sorts of things. We train them, and they can help you get the right product that you need. And if you need more help, then they can obviously refer on to us or anyone else that you might need. So have we got any questions for the last minute or so, Brian?
Not in the chat at the moment. So if you do have any questions that you want answered in the last few moments of this webinar here, please pop them into the chat. Type them into the chat now so we can get to those. But do have a look in the chat as well, as I just posted that survey link for you to request your certificate of attendance. So if you're after your attendance certificate for your CPD, please make sure to click that link and fill out that survey. But if we have any questions, speak now, or rather type now, or forever hold your peace, I think.
Yeah. Very quiet. They're very quiet.
Everyone's just processing all the wonderful information.
Yeah, hope it wasn't too much. Hope it wasn't too much. I hope it got you thinking, and that resource, there's a lot of resources on Tenor Assist to actually help you go deeper. We're here to help you, go deeper as well. We have a great clinical team. There's myself, and we have another continence nurse at Tenor as well. So you can, reach out to us as advisors to kind of help you walk through some of those kind of tricky clients to get good outcomes for them, that meet their goals and their preferences as well. It's a lot of thank you. So
that's very kind. Well, I think if there's no questions, then we can wrap it up here. As always, the SSS team and the Tenor team are always available to help. So if you do have any questions in the future, feel free to reach out to anybody, any of us, and we'll make sure to direct your questions to whoever can answer them. So thank you all once again for attending today's webinar. And yeah, do keep an eye out in your inbox as we will send out the recording if you ever want to watch back, or the contact details again, just in case. So do keep an eye on your inbox for those. But thank you very much. Thank you very much, Karen, and thank you very much, everyone, for coming.
Thank you. See ya.
Bye, everybody.